This meeting is being recorded.
Awesome. Well, good afternoon, everyone. Thank you for joining me. This is another segment of Coping Together, and this is a very special one to me because it's going to highlight the Guardian Advocacy Program. Just to start with introductions, my name is Sierra Ross. I am the Guardian Advocate Program Manager. I've been in this role officially 90 days on Monday, so I feel like I'm here to stay. I've enjoyed being in this role. I've enjoyed working with everyone at the Mental Health Association. It's been a wonderful experience. So I was really excited about highlighting this program this month. So we do have two special guests here with me. I'll give them a moment to introduce themselves.
Hi, my name is Rachna. I started volunteering as a guardian advocate in January this year. I'm a medical student at the University of Central Florida currently, and I'm hoping to be a psychiatrist one day.
Good. Awesome. Thank you.
Good.
Oh, Maxine, yes.
Hello, I'm Maxine Moe. I'm calling from Orlando Health South Seminole Hospital Behavioral Health, and I represent the counselors and the care coordinators here at the hospital who take care of all the people that get admitted to South Seminole Hospital Behavioral with mental health issues. And I'm thrilled to death to join Mental Health Association and thank the Guardian Advocates for all the wonderful work you do to support our patients in need. So thank you for having us.
Awesome. Thank you. And just to briefly share a little bit about the Guardian Advocacy Program. So in the state of Florida, there is a law called the Florida Baker Act. So within the law, anyone that is involuntarily Baker acted, they would be appointed a guardian advocate if, for example, they maybe reach out to next of kin, family members, anyone that's close to the individual that's not able to represent that person or be their surrogate while they are in a hospital, then a guardian advocate would be appointed to assist them with making decisions regarding their treatment. So with the Mental Health Association, we have partnered with 6 facilities in Central Florida. South Seminole is a new partner that we are excited about in the Seminole County area. And then we also have partnered with facilities in Osceola and in Orange County. So this is a very vital program. It's all volunteer based. So individuals that have an interest in volunteering, we definitely want to encourage you to reach out to myself. You can find out more information on the website as well. So we're just going to go through just a couple of questions just to have a discussion centered around the Guardian Advocacy Program. So the first question, more along the lines of being a guardian advocate, what factors contributed to you deciding to become a guardian advocate, and what keeps you committed to this volunteer role?
So I was born and raised in the Central Florida area. Went to high school in Lake Mary, so I'm really familiar with the local community. And I was on a research year last year, so I had some more time on my hands. And I've continued it this year as well through my 3rd year. But it's nice to get some hands-on experience related to what I want to do in the future. And it's also really nice to give back to the community that kind of helped raise me as well. So it's definitely something that you make time for and something that you have to be interested in. But I think giving back to the community was my main reason for becoming a guardian advocate.
Nice. Awesome. Thank you. Maxine, have you heard directly from any guardian advocates as far as their reason for wanting to be a guardian advocate?
Yes, I have. And I get pretty much the same response from Rashina. A lot of people who we talk to will become guardian advocates because they have a personal experience. They might have a family member or a close friend, and they see the need for those who don't have those relationships, and they feel a passion to represent people they are in need. A lot of them, some of them might be students going into the mental health field, but most of the people that I come in contact with, people who are personally related, and they feel a calling to be the heroes, such as Rashina, to represent those who cannot talk for themselves.
Okay. Awesome. Next question is, what advocacy steps have you taken to promote mental health awareness in your local community? So that's a question for all of us.
Well, I could talk first. Right now we have 988. That's going to start July 16th. And I belong to a couple of statewide and local advocacy groups, such as the Mental Health Awareness for the state of Florida. And it's up to all of us as advocates to represent the people who need that. Like I said, we all have bills and we have to let out congressmen and our leaders know that the people with mental health issues cannot be left out. And it's up to all of us to take part in advocacy to what extent we're able to. So again, don't forget 988. We're hoping to pass it by July 16th, and I'm sure we could talk more about that. So that's very close to my heart as an advocate for people who need it.
Awesome.
So the first thing that came to my mind was when I was an undergrad up in Gainesville at UF. I helped plan the first mental health awareness week. I think that was during my second year of undergrad. So it's kind of an idea that's always been close to my heart and like a topic that I've wanted to raise awareness about for a while. Even from a more like scientific standpoint, I think one of my panel discussions I'd had back then was about how there's a neurobiological kind of like imaging underpinning that you can show for a lot of these mental illnesses as well that people sometimes don't even know about. And so that's something called functional psychiatry that's coming up. So that's something that I did back in undergrad when I had a lot more free time.
Wow, that's awesome. Thank you both for sharing. It made me think also how I am advocating for mental health in my community, definitely amongst my friends. I encourage them, if they are interested, to seek maybe a therapist. I had a friend that recently just told me that she's finally ready to start therapy. I know she's had some experiences in her life where she just feels like now's the time. And sometimes that's just what happens for some people. They just find the perfect time for themselves instead of forcing them into it, definitely encouraging them. So I encourage family and friends for sure, because I know how I continue to benefit from meeting with a therapist myself.
Yes, and then as so UCF, for our own medical students, we have a peer support group. So that's something that really picked up during COVID with kind of online school and everything changing. I think a lot more people were utilizing our school therapists and even students to lean on. And that's something with interpersonal relationships as well that we can do all the time, encouraging friends to take some time off when they need a break to help prevent burnout. And just encourage people to seek out therapy because it can only help.
Yeah, that's very true. That's a very good point. Nice. Next question is, what would you tell someone who is interested in becoming a guardian advocate, but they are hesitant?
Well, this is Maxine again, and I'll be honest with you. I tell a lot of my friends and colleagues what the role is. It is a volunteer role. And if you're looking for something to feel like you're helping people, and it's really not that much pressure, but you feel so good about it because these are people that they don't have family or friends that could stand up for them. And family members love to do it, but I'm talking about the advocates we get from the Mental Health Association. I tell my friends, join it. You don't really have to, you're not really obligated, but you make a difference in people's lives to be able to approve them getting medication, getting wellness. And the people that I've told and have joined and gone through your training come back to me and say, Maxine, for so much. I thought it would be a good thing for me to do, but I feel so good just knowing to making a difference in these people's lives. And they thank me for telling them about the program. And I'm hoping more people will hear about it because we definitely could use some more people to join this mission.
I think that there's a lot that you can learn about Florida state laws that relate to mental health. We learn a lot through the court proceedings. That's something I had no idea about before becoming a guardian advocate. So if somebody's hesitant, I'd encourage them that it's a great volunteer opportunity and there's a lot we can learn, especially with increase in psychiatric conditions since the pandemic.
Good. Thank you. Next question is, do you think people in your community are aware of the Florida Mental Health Act? So the Florida Statute, Chapter 394.
I think some people are in the profession, but a lot of people, they heard of the Baker Act. I try to teach them what that is, and that is Title 394. It was first came up about in 1971 and passed by Maxine Baker, so I'll never forget that name,
Yes.
in 1972 in the state of Florida. And she passed that law, and it really explains to people these are as a crisis situation. This only means that you're evaluated by a psychiatrist within 72 hours. And then you either become voluntary discharge or re-extend the Baker Act, such as going to court and get you a guardian advocate. Again, some people know, but you'll be surprised when we speak to family members that they really don't know. And the more education we could provide for people affected by this in the community in general, I think that's something that needs to be done on a continuous basis.
I agree.
I don't think I have anything to add to that. I think it's just people that have kind of come into contact with friends or family or themselves that really know about it, and maybe people in the medical and like legal professions.
I agree with you both. I do know in the state of Florida, I believe the Baker Act is just specifically to this state. So it may be called something else in other states.
Right.
Because if I mention it to friends in other states or family members, they're not very familiar with it. So I think it's definitely a need for more awareness because a lot of people don't know about it. I think people may know more about an ex parte order per se, but it falls in line in somewhat alignment about that because I have gotten calls for people that are seeking information about how to do an ex parte order, or maybe someone that may be seeking guardianship for someone that is a family member that has a mental health challenge, and it's just a little difficult for them to take care of them, so they're seeking guardianship. So I think there's an opportunity for us to definitely have some more information and awareness about it in the community.
I agree.
Next question is, what advice would you give to a new guardian advocate? So this is someone that has completed the 4-hour certification training, they've done their background check, they've completed all the steps to officially become a guardian advocate, and they're ready to accept their first guardian advocate request.
Rashida?
Oh, yes. So I'm just thinking of someone that has just completed the process, and what advice would you give them before they even accept their first guardian advocate request?
Well, I had somebody that I recommended not too long ago, a friend of mine who's retired. And because she retired as a professor in Seminole State College, she was looking for something to make her feel fulfilled. So I recommended that she go through your training and she become a guardian advocate. And she was asking me, tell me what I can learn from it. And I suggested she talks to one of the guardian advocates and finds out from them what their experience is. And so it's one thing to learn it from us, but for somebody else who's actually in the field doing that, I think that's the best advice. And she promised me she would do that. So I'm hoping that she'll succeed and become one of our next guardian advocates in Seminole County, because that's where I am. And believe me, we could use it. But I think Rashida could tell you more from being a guardian advocate.
Mm-hmm.
Yes, so I think that the roles in the name, you're advocating for the patient that you have. You want to put their interests as your number one priority. Make sure that they're doing okay on their medications, that they aren't having any of the unwanted side effects, that they're happy with their treatment, bring up any concerns that they might be having to the medical team, and approve of their medications when they call you for it. So there are some responsibilities, and so I just advise them to kind of be aware of those responsibilities going into it, know what to expect, and do the best that they can.
Awesome.
And if I could add to that, one of the things that our patients, they love when the guardian advocate actually comes to visit them. Many of these people don't have anybody. So to see that somebody's out there that cares about them, put just such a smile on their face, and they feel so welcome and accepted. So that's another thing I would suggest that our guardian advocates know It's one thing to be on the phone and speaking to a professional to approve medication and treatment, but if they could come out and actually meet these individuals, it really is something special.
Awesome. Thank you both. One question that I probably should have asked to start this conversation, but we can close with this. So I would like to know from both of you your perspective of being one, a guardian advocate, what the process looks like on a day-to-day basis for yourself, and then also Maxine, for you, someone that is working at a facility, what does it look like? How does the guardian advocate program fall into line with what you do, Maxine?
Well, I could start. Ever since we joined partnership with the Mental Health Association, things are going much smoother because my counselors, whose job it is to get a guardian advocate, says it's really, really great to contact you, Sierra. So you might as well give a pat on your back and be able to get connected with a guardian advocate. It's a smooth process. It is the faster we can get that guardian advocate, the faster it can go to court, the faster the patient can get treatment and hopefully get well. So again, from a facility standpoint is that, again, our partnership relationship is wonderful. Please thank all your guardian advocates from us. And again, the faster we can get somebody signed up, the faster we can work on that patient getting well. So that's from a facility point of view.
Awesome, thank you.
So from a guardian advocate point of view, Sierra is on top of things. She hears from people like Maxine, sends out an email to us weekly, sometimes multiple times a week, and tells us which locations in Central Florida are requiring how many ever number of guardian advocates that week. And then whoever is free and available to drive to court and do those patient visits for that week takes them on. And so that's how it kind of works on a volunteer basis.
And we thank you so much. And if you could get your friends to join, I want to tell you, I haven't met you personally, but it's a privilege to see you and to know people just like you. You are the hidden heroes. I hope you know that from our standpoint.
You're too kind. But I did actually, so the reason I became a guardian advocate is because my friend from high school recommended the program to me because she volunteered with the Mental Health Society of Central Florida. So I do think that word of mouth definitely helps to get more people involved.
Yes, that's really true. I know someone reached out to me a couple of weeks ago and their friend referred them to the program, or maybe a family member told them about it. So word of mouth is really important. So we are going to close. Do either of you have anything else you would like to share about the program?
Well, thank you. You are making a difference. I see people every day, multiple people who have needed this program. And I mean it, Sierra, you're doing a fantastic job. And the more people that can get out there and join the program, all we can say from Orlando Health is thank you.
Oh, awesome. Thank you. I couldn't do it without our volunteers and also those that are working within the facility to help this process and make this program the best program ever. Awesome. Well, thank you both so much for your time. With everything that you do, the hours you put in, it's definitely appreciated. And so we're going to close out. If any questions that we may come across, I can definitely share with both of you. And I look forward to continuing to work with both of you. So thank you so much.
Thank you, guys. Have a good day.
Thank you. You too.
Okay, bye-bye.
Bye.